Proper screening can save lives. That's the message MedStar Health wants to share about colon cancer. Joining us to talk about the colon cancer screening program at MedStar are Michael Sickler, Program Manager, and Registered Nurse Tiombe Mitchell. Thank you so much for being back here. We had you last year talking about this. It's that time of year that we're thinking about it again. So let's start with the numbers. Tiombe, tell us how common this disease really is.
So colon and rectal cancer is the third leading cause of cancer deaths in the U.S.
Wow.
Maryland numbers have shown 2,400, a little over 2,400 have been diagnosed in Maryland. So it's pretty common.
And I think a lot of people want to know, is it genetic or does it just sort of happen?
Well, it's a slow growing cancer. Genetics is a factor, so it's important for people to know their family history, talk to their doctor about any concerns they may have about their knowledge of family history, as well as if they're having symptoms or issues. Those things can all be a factor of getting a screening early for colon cancer.
You talked about screening, so how much can screenings actually help, and when should we start getting screenings?
Screenings are the key. If you are not being screened, you cannot tell if you have a cancer because it's visualized in the colon during a colonoscopy, which is the gold standard. We recommend that for everyone, but there are other tests that you can have done. You can do a stool test at home, which is prescribed to you by your physician. They have stool DNA tests as well. And then shorter outpatient surgeries called a flexible sigmoidoscopy. It doesn't see the entire colon, but some people
can give you an idea.
It does.
All right. And then Michael, tell us about MedStar's colon cancer screening program in general.
Okay, great. We've had the program for over 10 years.
Yes.
The program is funded by the State of Maryland Health Department and the Cigarette Restitution Fund. And we provide colonoscopies at no charge to eligible patients. We supply them at 4 different hospitals of MedStar's: MedStar Franklin Square, MedStar Good Samaritan, MedStar Harbor Hospital, and MedStar Union Memorial.
And we'll put that information on the screen as well. And here we're seeing some video. What are we seeing here, Michael?
We're actually seeing the actual scope that is inserted during a colonoscopy.
Okay. And then I'm wondering also who is a candidate for this program, because you said that it's funded. So people, they want to make sure that they're getting these screenings if they don't, especially if they don't have to pay for it.
Right. So we screen both men and women that are age 50 or older. If you are younger than 50 and you have a family history of colon cancer or a personal history of colon cancer, we can screen you. Also, if you have symptoms of colon problems, we can also screen you as well to make sure that we catch any problems that are early. You have to have either no insurance or or underinsured.
Right.
And basically what we're doing there is we're paying for the whole colonoscopy if you don't have insurance.
Yes.
If you have insurance and you have any out-of-pocket expenses, we will pay for it.
Okay.
So you have to be on a limited income, and basically we will talk to you to make sure you're eligible, and then if so, put you through the program. Yes.
How do you know for sure if you qualify? It's just
call us.
reaching out.
Sure.
Okay.
Yeah.
And then where do people get screened? Is it at those 4 locations?
At the 4 different hospitals. We also try to eliminate a lot of barriers that people have. So we try to provide transportation if you have struggle with transportation. We also have a Spanish interpreter if there's any language issues that you have. The other key component is that if you have a diagnosis after the actual colonoscopy, we do have funds to make sure that we take you through the whole course to make sure that you're taken care of after the colonoscopy if there is a problem that arises.
It really is amazing, because I think a lot of times people want to take care of their health and they want to do these screenings, but they think about how expensive it is or how am I going to get there, and you literally just eliminated all of those issues.
We try, yes.
Yeah, you're really helping the community. Okay, so people are going to watch, they're going to want to get more information. What should they do? What are the next steps?
You can give us a call at 410-350-8216. We have a Spanish line, which is 410-350-3444. Also, if you do not live in, we do the jurisdictions of Baltimore City, Anne Arundel County, and Baltimore County.
Yes.
If you don't live in those jurisdictions, you can still call us, because every county in the state has a program we can refer you to.
Point them in the right direction.
Exactly, to get screened.
Yes. Thank you so much for providing that information, Michael and Tiombe. Appreciate it.
You're welcome.
And we'll be right back with more Midday Maryland right after this. Stay tuned.